Hi, good morning, everybody. Thank you so much for being with us here today. My name is Maggie Gomez. I'm the Director of Community Organizing here at Center for Health Progress. And I'm so excited to be able to welcome you all to our annual fundraising luncheon. We are celebrating 20 years as an organization this year, but this is our first luncheon as Center for Health Progress since we changed our name in March. At Center for Health Progress, we believe that our healthcare system should work for all Coloradans. So, we bring people together, people like all of you, to ensure factors such as race, income, and zip code don't determine a person's access to care or opportunity to live a healthy life. We know that when we uncover common sense solutions to these complex challenges, we get closer to ensuring our healthcare system works for everyone. Because when our neighbors are healthy, our communities prosper, and Colorado is stronger. We think one of those solutions is to address the root causes of the barriers to good health that many Coloradans are facing. And that's why we're so excited to be stepping into that space alongside with all of you today. Racial injustices are some of the biggest root causes of health inequities. So we have an incredible speaker here with us to help move this conversation forward. After her keynote, we'll have a short time for Q&A, followed by some remarks by one of our esteemed board members about her work with Center for Health Progress. And then we'll close out the event with one of our favorite moments of the year, our Community Champion Awards. This year, we have 5 amazing, hugely deserving leaders whose work is transforming the lives of Coloradans every day. And we look forward to honoring them for that work. Before we get started, I'd just like to say thank you to all of our sponsors. Without them, this event would not be as amazing as it is. And they're all listed in your program. But I'd like to give a special thank you to our premier sponsor, Delta Dental Foundation, whose leadership on oral health issues in Colorado is absolutely fantastic. We know that oral health is one of the greatest healthcare challenges. Absolutely. We know that oral health is a really big challenge in our healthcare system in Colorado, and it's also one of the least talked about. So thank you again to Delta Dental Foundation for all your hard work and continued partnership. We'd like to also thank all of our major sponsors today. Centura, Colorado Access, Denver Health Foundation, Health Management Associates, Kaiser Permanente, Mental Health Center of Denver, Rocky Mountain Health Plans, SCL Health, University of Colorado Health, and University Physicians. Give them a round of applause too. And now, I'd like to welcome Aisha Fields, one of Center for Health Progress's board members, to introduce today's keynote speaker.
Good afternoon. My name is Aisha Fields, and I'm proud and I have the privilege of being the Executive Director of the Fields Foundation. I'm also a family practice nurse practitioner and a proud member of the Center for Health Progress. Let's give them a round. I'm especially excited about today's keynote speaker and topic because I think it highlights some of the most important shifts we've been making as an organization and as a country over the past several years. A lot has changed in the past 20 years since our founding. We found that there is a need to change, and that the moment to change is right now. One of the shifts that we've seen is to be bolder about our language and also about our actions, to hold the healthcare system accountable for its role in perpetuating health inequities, and to call out institutional racism for what it is. I'll be the first to admit, as a woman of color, sometimes it's a little uncomfortable to speak those truths. Sometimes the best gets the best of us. However, when we find ourselves being addressed with the opportunity to address these uncomfortable truths. It's time to embrace our collective power, a lot of which is held by each of us in this room today and those grassroots community organizations and people that we represent that are not in this room today. But that is also a huge opportunity for us to come together as leaders and stakeholders to help move Colorado forward in the way we would all like. Today, our keynote speaker, Rinku Sen, she knows an incredible amount about racial inequities. Not only because she's overcome them herself as a woman of color, but she's also led an impeccable organization called Race Forward. Her wins came very early on through a short white paper report entitled Shattered Families. This report changed the immigration debate as we know it today, showing how deportations were resulting in thousands of children across our state and right here in Colorado being deported and placed in foster care systems, separating them permanently from their natural-born parents and their legally parents into the foster care system. Rinku was also the architect of the Drop the I Word campaign. How many of you have heard of that, the Drop the I Word campaign? It's really a common sense approach, which lobbied media outlets to stop using the word illegal immigrants or illegal aliens. How many of you all believe in that today? To share with us today to help us get fired up and ready to go to lead the transformational change that we need right here in Colorado. She is transforming the way we talk about race. She's transforming the way we see race. And her tactics are individual and they're also intentional. And that's why we've invited her here today to lead us all on our journey to transform how we talk about race and deal with health equity here in Colorado. So we're thrilled to have Ms. Rinku Sen here with us, and we can't wait to hear what you have to say. Ladies and gentlemen, without further ado, please let us welcome together Ms. Rinku Sen.
Much, Maisha, for that thoughtful and enthusiastic introduction. I'm really excited to be here with you. I hope you're all having a really great and healthy lunch. I'm not eating it because we just had breakfast, but it looks, fortifying. When I was getting ready to come and do this talk, and after I talked to Joe a couple of days ago, I was reminded of this woman that I met at a training that I did about a year and a half ago. And actually, I remember the date perfectly. I think it was April 16th because I was training and it was the day that Prince died. So while I was training, we got the word that he had passed away. And so I just feel like I'll never forget that day and what we were all doing. But one of the people in that training was a woman named Gabriela Paniagua. Excuse me. Been sick, so I'll probably cough a little bit. Gabriela Paniagua, who was a nurse, and Gabriela is a nurse in one of the premier transplant hospitals in New York, Mount Sinai. And during the course of the training, we started talking about transplants and pain. In 2016, there was a flurry of articles that came out about studies that had been done of how doctors treat patients of color for pain versus how they treat white patients for pain. And Gabby was reflecting on her own direct experience in the transplant unit dealing with pain. And a couple of the things she said to me was, the first thing she said was, this is really what it means to manage pain in the transplant unit. So somebody gets a new organ, a new heart, a new lung, a new kidney, and if they cannot breathe properly, then their blood won't be oxygenated well enough, and their body will actually reject the new organ. And so in all of healthcare, it's very, very important for people not to have pain because it affects their breathing and their activity and their healing. So pain management is something that you have to do properly all the time. But in the transplant unit, if you mess it up, then probably the transplant is going to go bad. And we can all imagine the pain and suffering and waiting and expense that goes into getting someone an organ transplant. So you don't want that to happen. You don't want someone's organ to be rejected just because the doctor didn't ask hard enough and specifically enough, do you have pain? So Gabby came up with all these solutions. She taught herself to ask, do you have pain in 5 different languages. She taught herself some of the ways, some of the cultural nuances of how people deal with pain and worked around them. And all of the nurses that came to work in her unit, she would teach them the same thing. Ask in these 5 different languages, make sure that you're really getting to the question of pain. But it made me start to think, what if you were in a transplant hospital and you didn't have Gabriela Paniagua as your nurse in that transplant unit? What if you just had some colorblind set of doctors and nurses who figured if they asked you, do you have pain in English, and you made a sort of ambiguous gesture or you said no, that was the end of it, then you would live with your pain. What if you had been taught to live with your pain all your life? So then you'd live with your pain, but you wouldn't live very long because your body would reject that organ transplant. So we do know from research and data what happens when there isn't a Gabriela Paniagua around in a hospital. We know that relative to white patients, black patients are less likely to be given pain medication. And if they do get it, they get lower quantities of it or a lower quality. Black patients are 17% less likely than white patients to receive medication, pain medication, if they break an arm or a leg, in which case you would want some opioids, opioid addiction problems notwithstanding. In the study of 1 million appendicitis cases, which is usually affecting children, we found that white children are almost 3 times as likely as black children to receive strong pain medication. And what's interesting about all these studies is that they also show that there's no racial animus behind these misdiagnoses. So if you ask these doctors who are giving out less good pain medication to their patients of color, do you hate black people? They would say, no, of course I don't. Do you want them all to die? No, of course I don't. I treat everybody the same way, they would say. So conscious racial animus, racial hatred, is not a requirement of racial harm, at least when it comes to diagnosis and treatment and pain. However, one study did find that among 222 doctors, a large number of them, half of them, held false beliefs about black patients. So one study asked 222 doctors if they believed these 4 things, these 4 false statements. 1 is blacks age more slowly than whites. 2 is their nerve endings are less sensitive than those of whites, like literally black people don't feel pain. The 3rd was that black people's blood coagulates more quickly than that of white folks. And the 3rd is that black people have literally thicker skin than white people do. These are all false, but half of the doctors who were respondents in this study adhered to at least one of those false beliefs. So, and then of course, they found a correlation between holding a false belief and treating pain in the wrong way. It's not just in pain, of course, that this happens. One study of cancer patients showed that 50% of white cancer patients get adequate treatment, get the treatment that they need, but only 35% of patients of color get adequate treatment. Now, neither one of those numbers is good. You don't want half of white cancer patients getting bad treatment. That's ridiculous. Nor do you want 65% of people of color getting bad treatment. But to me, it reveals that particular duo of statistics reveals that in a situation where nobody is getting all of what they need. Often, the reason that's happening is that public policies and money investments, as well as private rules and money investments, have been based on the idea that people of color are stealing things, stealing our public goods, and they have to be prevented from stealing those things. Therefore, we need to not have those programs. And guess who also doesn't get the programs and the remedies that are blocked through appeals to racism, through discussions about who is deserving and undeserving? It's struggling white folks who also suffer from the lack of welfare programs, or cuts to public education, or cuts to our public health systems. So in the face of statistics like these, dramatic statistics, life and death kinds of statistics, I need, as a racial justice leader, if I can call myself that, I need you to lead with me. I need you to deal with race. Not just incidentally, not just every once in a while, not just when you are called out to do it, but really consistently and courageously and boldly, and as part of your daily practice, whether you are a practitioner or a researcher or an administrator or a fundraiser or a policymaker. You protect people's health. And so your ability to take race into account as you plan and go about your daily life and your work, those are literally life and death kinds of decisions that you can influence. And I need you to influence them in the direction of racial justice. And I need you not to be namby-pamby about it, but really for real about it, because the stakes are higher now than they have been in 50 or 60 years. In 2 generations, the stakes around racial justice, health care are higher than they have been for at least 2 generations of people before us. It's not because racism ever went away, but it is because it is resurgent, it is emboldened. When white nationalists are marching through the streets of Berkeley, California, there really isn't anything other than resurgent. There are no other words that you can use for that phenomenon, no other way to describe it. And that resurgence is going to increase health inequity. It's going to increase the fairness gaps within healthcare. 2 weeks after the election, there were nearly 800 cases of hate violence recorded, and those are just the recorded incidents in 2 weeks, within 2 weeks. Hate violence obviously affects people's health. Racism itself has an effect on health beyond direct violence. One study found a pattern of low birth weight among Arab American women who gave birth in California in the years after 9/11 and to the anti-Muslim and anti-Arab reactions to 9/11. So discrimination causes trauma, and trauma takes root in the body, and that is going to affect both this current generation of people of color, but also something like 4 generations to come, because that trauma actually begins to change the DNA that people hold. So what can you do? I know that's the question you want me to answer. There are 3 things I want you to do. The first thing is I want you to get really good at talking explicitly about racial injustice and about racial equity. Being real straightforward about it, real talk. Second thing is I want you to do that by focusing much more on impact than you do on racial intention. And the third thing is that I want you to build your physical and emotional fortitude for doing that work. I want you to build your racial equity muscle. So let's talk about that first bit, being explicit, though not exclusive, about our racial justice commitments. James Baldwin once wrote that not everything that is faced can be changed, but nothing can be changed until it is faced. There is no way to solve a problem that no one is willing to name. And in fact, the first fight is whether or not you are allowed to name race as a factor in people's health, in their health care, in their access, and in the competence of the care that they get. So the biggest obstacle to that kind of explicitness is colorblindness, which has become the default dominant racial ideology in this country. And So we can say that nationwide, white supremacy is, avowed white supremacists are a minority of people in the country. I do believe that, but if white supremacy isn't the avowed national ideology on race, what is the avowed national ideology is colorblindness, the idea that we don't see color, and we treat everybody the same. And I understand why that is an emotionally appealing ideology. It makes us it does have a certain logic to it. If seeing racial difference has led to the enslavement of people and lynching and discrimination on the job and in housing, then sure, the solution must be teach people not to see it. But the problem is that the human brain is incapable of ignoring racial difference. It just is very obvious that the 4 people sitting at this table are 3 different colors and 3 different racial groups. Maybe more than 3, for all I know, but at least 3. And there isn't a way for my brain to not see that. You know how you remember during the election cycle, someone put up these horrible statues of a naked Mr. Trump? You had that, right? You saw those. They were giant orange naked statues. You cannot unsee that once you see it. And neither can I unsee these folks here. So colorblindness being scientifically impossible then just becomes kind of a cover for not being able to talk about the racial dynamics that do in fact exist in the world. So, every once in a while I do radio, and I like to do right-wing radio. If any of you have a right-wing radio show, I'd be happy to come on it. But every time I do it, this thing happens where a white man calls in and says, "You are distorting Dr. King's message. You have twisted his legacy because you're talking about race all the time and you're using it to divide us. And he said we should be colorblind." He said nothing of the sort ever. Judging people by the content of their character is not the same thing as being colorblind. And these white men always have one Indian friend who arrived in the country with 10 cents in their pocket and like 5 rupees or something, which is worth about 10 cents. And in all the time that they've been here, have never encountered one bit of racist discrimination. And I'm thinking, yeah, they're not going to tell you about it. So since their one Indian friend has had no discrimination against them, how come I, this Indian who should know better, am not with that program? What I see as a potential obstacle in the health equity field actually is that the language of equity in the health field is often around the social determinants of health. Geography, access to health care, income, and those social determinants are deeply racialized, but yet you can't actually say race. Geography and income heavily a result of racial arrangements, of Jim Crow segregation, of housing discrimination through the 60s and 70s against black vets and vets of color returning from World War II and Korea and Vietnam. So in your field, you sort of stand at the cusp of the danger being that in talking about social determinants all the time, that you will actually elide the role of race, cover it up, and not be able to say it because you're used to using proxies all the time, geography, income, etc. Now what that ends up amounting to on the progressive end is often folks saying, well, it's really class and the economy that's the problem. It's because people don't have money. It's because people don't have health insurance. But many, many, many studies of race and health show that even when you control for economics and for insurance, the outcomes are still deeply gaping according to race. So it isn't just class. Dr. Carmen Green, who's an anesthesiologist and a pain specialist and a professor at the University of Michigan, She's quoted in the New York Times on one of these pain stories saying, and she studied treatment disparities for years, she said that the role of race is actually more important, although race and class often interact. So we have to be able to talk about the role of race if, in fact, we're going to be able to close those social determinants of health inequity. Explicitly then, as long as we're being explicit about it, we want to define and operate on the right definition of racial justice. And the one that my organization uses is this. I don't have a slide for it, so I'm going to say it twice, so you can write it down or look it up. It is the systematic, fair treatment of people of all races that produces equitable opportunities and outcomes for all. And the two most important words in that definition, the first one is systematic, because if you don't have systematic, then you're going person by person. You have to convince every single doctor in the United States that they need to ask a set of pain questions in a different way than they currently have, and that and you could actually do that by training them in medical school differently. One of the things Gabriela Paniagua said to me was, whether or not patients get good pain care should not be about whether they happen to find me as their nurse, and then I'm creating all these experiments to figure out how to fix it. It should be part of the way nurses are trained, doctors are trained. It should be part of the diagnostic protocol in a different way. That's what it means to have a system around pain rather than going one by one. So we have to be systematic, because one by one is going to take too long and too many people are going to die that way. Outcomes is also an important word, and people often give me trouble over that word in this definition. On race, race conservatives especially love to say we provide all the opportunity in the world. We're the shining city on the hill for opportunity. Excuse me. And that should be enough. After that, you're on your own. You rise or fall by individual merit, according to individual merit. Apparently that word didn't get to the admissions offices of Ivy League colleges, because they have legacy programs through which many people who did much worse on their SATs than I did get into Ivy League colleges. But anyway, these same people are obsessed with opportunity being everything. And this is what they'll say to me. They'll say, you can send all the kids to basketball camp, but they're not all going to come out Michael Jordan. You know, your Michael Jordans have to have like real recognition for being Michael Jordan, for the talent and the hard work and the perseverance that Jordan brings to the game. Well, okay, sure, yeah, they're not all going to come out Michael Jordan, and Michael Jordan is exceptional. I'm happy to acknowledge those. But what is the point of basketball camp? That is the question. What is basketball camp supposed to produce? Is it supposed to produce Michael Jordans, a number of them, or what? What else? What else could basketball camp produce? Tell me. Teamwork. You get to be in a team and experience it. What else? You have some athleticism and get exercise, and you develop a love of movement. What else? Fun. And you might actually learn how to play basketball. Is that not the goal of basketball camp? All the kids learn how to play basketball, and they practice enough to get better at it than they were before. So in other areas of American life, we insist on good outcomes. If a corporation says to their investors, hey, we gave you the opportunity to make a profit and gave ourselves that opportunity, but we didn't actually make the profit, please keep investing in us anyway, they'd be laughed out of the SEC, you know, nobody would get, or out of Wall Street or whatever, the stock exchange. So we insist that outcomes and impact is the bottom line in many parts of life, but somehow when it comes to race, then all of a sudden it's like opportunity is enough. But if the opportunities you're providing are producing wildly disparate outcomes, and the reason that you are going to land on is not that people of color are actually inadequate. We cannot take care of our own health. We will never be able to play great basketball. We are too dumb to graduate in large numbers from high school. If those are not your reasons for racial gaps, then you have to include impacts in your definition and outcomes in your definition. And that leads us to why we focus on impact rather than intention. In our country, the dominant definition of racism is that it is individual, intentional, and overt hatred. And sometimes, even then, even with the noose hanging, people will not admit that this was actually racial. They'll debate motivation until you can't debate it anymore, until you're worn out from saying, oh, but that is actually showing animus, and that statement is actually really offensive, and that piece of policy is borderline racist, whatever it is. If you focus on intention, you will almost never win. Almost never. And in fact, our civil rights laws are created, they're crafted to themselves focus on intention, because when the Civil Rights Act was being crafted, race conservatives said, you cannot make that about impact or we're out. We're not passing it. No way. Don't do it. So if you read the Civil Rights Act really carefully, especially the employment portions of it, you'll see lots of places where people are forced to produce impact, but discrimination can be either strategically hidden. All that has to happen is the crafter of the discriminatory activity doesn't mention actual groups of color, like just leaves that part blank. Voter ID laws are a really good example of this. They're not crafted, and they don't say, hey, we want all the black people to produce extra IDs. They just make people produce extra IDs, and knowing that the impact will be heavily on black and some other communities, young people, etc. So to help your community understand racism as a system, you have to get them to release the individual, overt, intentional definition as being the only way that racism exists. Of course there is that kind of discrimination, but there are a lot of other kinds too, and we have to be able to see and address that whole spectrum. So one of the reasons, so if something is not strategically hidden, what might be behind it is unconscious or implicit bias. And that is just bias in your brain that comes from your brain's function of rapid association and deciding who's in my group and who's not in my group super, super, super fast so that I can run if I need to. This is about like prehistorical human brain evolution. If I look at 3 different versions of a chair, my brain wants to do that really efficiently and know that each one is a chair and I can put my butt in it, because if I have to spend my brain energy figuring out what's a chair when it's kind of obvious, then I have less energy for figuring out how to feed my family or how to end racism or how to get people healthy. So the brain is geared toward self-protection and toward efficiency. And that allows all sorts of biases to embed themselves in our brains. And not just in the brains of white people, but most people in the United States show an implicit rapid association preference for lightness or whiteness. Now, having an unconscious bias means that it's not your fault, but it's still your bias, and it's still your responsibility to deal with it, particularly if you are running or influencing systems. One of my favorite stories is around health equity, comes out of Idaho. Idaho Community Action Network is an organization, community organization. They organize low-income white, Native American, and Latino families. And one of the things they were noticing is that many of their families, who are all eligible for S-CHIP, everybody knows what S-CHIP is, right? It's health equity crowd, okay. They're all eligible for S-CHIP, but they would go and apply and they'd always be rejected and turned down. So they wanted to know, well, what is going on and how do we fix that? And they decided we need to do a racially explicit test of the system so we can see whether everybody's rejected for the same sets of reasons or not. And out of that test, we'll understand what solutions we need to push. So they did matched trio testing. They set up trios of families, 1 Native, 1 white, 1 Latino, with similar ages, numbers, income levels of kids. And they went in and applied, 27 families applied, 26 are rejected. So they were almost all rejected. And I'm going back here to this, like 50% of white people don't get what they need either, while it's 65% of people of color. So all the families are rejected, at least a third of them are white families. And what they found out from the analysis was that the long and complicated application form, that's a problem. Nobody could ever figure out. Easy to make a mistake, tiny print, hard to figure out what the mistake was. The hours that the SCHIP office was open, 8 to 4, that's when working people work. They can't be sitting in the SCHIP office day after day. They're losing wages if they do that. So the hours had to change. But in addition to those two problems, they found that when the Latino families went in, they were asked all these intrusive questions. In fact, illegal questions that at least at that point the federal government said, you cannot ask about SCHIP. How did you get across the border? Who's the father of all these kids? How many of the people in this family are quote unquote illegal? They're irrelevant. Kids have papers, kids are eligible, income eligible, you sign them up and call it a day. So if they had not done that race explicit test of impact, they would have solved the forms problem and they would have solved the hours problem, but they would not have even known that they had to solve this problem of retraining the caseworkers. And they understood that getting all the caseworkers fired for being racist was not the solution. The solution was to set up in the system a check against that kind of implicit bias. My favorite story about health equity. So my last point is that to do this work, you have to build up your strength. It is upsetting. It is emotionally draining. And it's rough on white people, but it's also rough on people of color to constantly be having to dredge up our terrible stories. I have a terrible story about how another white girl showed up to my 13th birthday party. I hate telling that story, but sometimes I have to tell it because it's effective for moving whoever I'm trying to move. But after I tell that story, I have to go remind myself that I'm no longer 13 years old, that I can have other parties with other people, So for white folks, I'm gonna say that if we are silent, well, for all of us, if we are silent, then the only people talking explicitly about race are gonna be white supremacists. That's it. Everybody else is gonna be race silent, trying to do their colorblind thing. And who do you think is gonna win in the discourse fight in that situation? They're speaking, we're silent. That's not gonna work. So, it's like only your proudly white supremacist auntie will ever say anything about race while you're avoiding dealing with it. So you can't avoid it. But to live and exude the opposite of fear and avoidance and panic, the opposite of those things are forthrightness and courage and calm. And so you have to build your reserves of forthrightness, courage, and calm. And if you're white, you have to know that all this white fragility is not going to get the job done. For 4 years now, we've had white folks all over the country howling that all lives matter, when it clearly is not so. You can make it so, but you have to stop that howl. You have to interrupt that howl, and you have to turn the gaze, because the whole point is, by howling all lives matter, I can ignore the ways in which these lives are being destroyed. You have to make it impossible for that looking away, that avoidance to happen. For people of color, though, we need to build our muscles as well. I mentioned generational trauma. They say that a deep collective trauma lasts 4 generations. Nothing bad has to happen to you for 4 more generations in order for your your family to recover from it. And that just hasn't been the case. We haven't had people of color able to go 4 generations without any new traumas. However, we cannot let our triggers run our strategy. I'm not going to tell any person of color, don't be angry as you are, don't cry. The shit we're dealing with is tragic and it's enraging, but we can't make strategy from that place. It's going to be bad strategy no matter how good a strategist we might be. We have to release those triggers or find other ways to manage them. And we have to have our alliances and take care of ourselves and take our breaks, but we have to be able to stay engaged. and part of the struggle. So I know that you can do this. I know that you can redefine racism. I know you can be explicit. I know you can focus on impact, and I know you can toughen up. If a bunch of low-income moms in Idaho can do it, I know that you can do it. And I expect you to do it. I hope that you will do it. I am with you as you do it, and you can be with each other too. I understand, though, that it's not the easiest thing to do. It can be really hard, and it can ruin parts of your life and many of your days. I understand that racism wounds us all in different ways, and as a nation, we've got this giant gaping wound around our racial history. And there are many, many days that it feels like that wound will never heal, that it will just fester forever and grow. But I try to remind myself, and I'm going to remind you now, of that line from the poet Rumi, where he says, "The wound is where the light enters." The wound is where the light enters. So if you can think of your wounds as the places where the light enters, and if we can do that collectively, then I think we can actually all heal ourselves, our communities, and the country. Thank you.
Talked about internal biases and internal bias. I'm really curious about the stories that institutions make up about people and how institutions can counter implicit bias.
Great, thank you. That's a really great question. The first way that comes to mind that institutions make up stories is when they're parsing out who deserves and who's undeserving. Who is deserving, who is undeserving. Who is meritorious and who isn't in colleges, for example, or in hiring. And one of the things that I find is if you actually have a discussion about merit, no one can agree what actually constitutes merit. There are a lot of versions of competence and merit in the world. And I also find that there's so many unspoken assumptions built into that deserving, undeserving designation. And a lot of what works, I think, to counter implicit bias is to make it explicit, make those assumptions explicit. When people say, oh, our education system provides opportunity for everybody, and if you can't do well, that's on you, then there's so many assumptions about the schools that people of color go to, about families of color embedded in there, and often I will try to actually get people to say those assumptions, because when you don't have to speak them, they can live on in your brain as a reasonable assumption. But when you actually have to say black families have problems studying and that's why they can't do well in school, it sounds ridiculous, right? Like, who says that in a colorblind society? Why would you even think that? So, deserving, undeserving, merit, those are a lot of the places where implicit bias shows up.
Who else has a question for Rinku? Yeah, please. If you can stand up.
I can repeat it too. Oh, my traveling.
Lisa Soto with the American Diabetes Association. You spoke about being bold when talking about racism, classism, everything else, to be up front, right? But once we're up front, when I attend meetings and I say the word, Mexicans and blacks are being discriminated because you guys are doing A, B, C, and D. You see how the room stay quiet? Well, meetings, that happen too.
Yeah.
So then, I'm the troublemaker.
Yep.
Because I'm the one that wants to speak up for my community, especially the monolingual Spanish-speaking community, the Mexicans who people call them undocumented. For me, they're just human beings, right? I was there 19 years ago, and people wouldn't even know that I was undocumented, right? For me, I was just Julissa. I was pretending like I was a citizen because I always feel like I'm a citizen, right?
Yeah, claim
So
it.
you say to be bold, but once you're bold, you get in trouble. You might be fired. Systems might put you in different places. You might not get promoted. And
Yep.
I know that because I live through that every day of my life. So tell me, what kind of boldness, or how can I tone it down in order to not get in trouble?
Well, I think the first thing, thank you for that question, that was awesome. Separating impact from intention is a way of toning it down. So what you have to do, I mean, often white folks will say to me, like when we were doing Drop the I Word, editors and reporters from all over the country would say, who use the word all the time, they'd say, oh, but we don't intend to discriminate against Latinos. It is the legal word, it's not. It is the easiest word maybe, but doesn't have to be. And they'd say, we don't intend to. And a lot of times as people of color, when somebody white says, oh, I didn't intend to, our reaction is, you know, well, F you and your good intention. Like, I don't care. But actually, we should care. We should care that the intention was good and not bad. Because if I can't acknowledge that there wasn't bad intention there, then I'm going to consolidate those people who are well-intentioned but doing the wrong thing into the camp as the people who do have actual bad intention. I don't want to consolidate that white supremacist camp. I want to split that up. So all of the people who are well-intentioned, I need to acknowledge their good intention, not dismiss it. So you might say at the beginning of your bold talks, I know you don't intend to, but this is the impact of these actions, whether they're individual actions or collective decisions or rules. The other thing I would say for you, though, is that if you try to do this by yourself all the time, you will fail. You're one person against a 500-year-old system. You are not going to win by yourself. And we have all these heroic individual stories in American life, and they affect people of color too. Like a number of people of color who think, you know, Martin Luther King did everything. It's not that he did nothing, but it's that you have to have all this infrastructure also operating and people actually organizing and in the collective. So what I think my advice for you, or if I was you going into a meeting where I knew I would have to make an intervention and I knew that I was going to get that reaction, what I would do is figure out who else was going to that meeting, whether of color or white, and I would recruit 2 or 3 other people to do the intervention with me. If you do it by yourself all the time, it's so easy to dismiss you. But if you're an organized, even a small group of organized people, much, much harder. And that's hard. But I think sometimes it's like in strategy, something will happen, an incident will happen, and the community will jump straight to, we want to have a march. And it's like, well, what are you going to demand? And who's going to come to the march? And sometimes you need a lot more education in the institution and community and body of people before you can go to the march. So I'd say more one-on-one time is actually where you're going to be able to connect with people, and then they might be able to protect you when you step out that way. Right now it feels to me like you're too isolated, and so then yes, you're going to suffer all that retaliation. But if it's you and 4 people, you see my numbers keep getting bigger because I'm ambitious. Like first you just need 1, then you need 2, then you need 3. Then, you know, they'd have to fire all 4 of you, and that's just harder. It's harder. They'd have to punish all of you. So impact over intention, and like be kind about the intention if you can. And if you can't be kind about the intention, find something else you can be kind about so you can connect with the people that you're trying to change and organize.
All right, I think we have time for 2 more questions, maybe one from either side of the room. If anybody on the right over here has a question for Rinku? On the left? Yes, over there, Maisha. Great.
or discrimination within human resources.
Within,
Within human resources.
okay.
And I'd like to find out what kind of ideas do you have that we could potentially develop, train, educate, and hire a more diverse and inclusive workforce that represents the communities that we serve as nurses, healthcare providers, and even people at the foundation level.
Yeah, so the question was, in human resources, how can we improve practices and systems to have more diverse workforces? And I really think this is the cutting edge of racial equity work in the next period, because while the public sector may actually retreat from health equity or racial equity modes, the private sector has the potential actually to really step up. And so a few things are, you know, the first thing you want to do, I think, is look at all of the places in your hiring systems where implicit bias could creep in, and create some remedies for that. And broadly speaking, the remedies against implicit bias, one is you remove the opportunity. Like, did you all hear that story about Jose Rodriguez, who changed his name to Joe? Applied for jobs as Jose, couldn't get any callbacks, just changed the first name to Joe, and all of a sudden had interviews. This was all over Facebook about a year and a half ago. So if you do name blind receipt of applications, then you remove some of the opportunity to judge a Jose differently from judging a Joe. Ban the box policies are about this, removing the opportunity to discriminate against someone with a criminal conviction if it doesn't matter for the job. So you can remove the opportunity. The second thing you can do is make people stop and think. The Rooney Rule in the NFL, I think it's the NFL, so the Rooney Rule says that when an NFL team is hiring a new coach, that at least one of the top 3 candidates has to be of color or diverse. And it is a rule in the NFL, so that means that you have to work harder in your system if you're hiring the coach to make sure that you have at least one really viable candidate of color. That's a stop and think and rework. And the very last way is to reprime the brain. So that's like you change people's literal perceptions of people of color in their brain. And that is the hardest part to do. It's the slowest, and it reverts back the most easily. So those are 3 ways to think about in an HR system how you could do better. Are there places where you have to remove the opportunity to discriminate? Places where you could make your team stop and think and work harder, slow down. One thing we do know is that stress and rushing, stress and speed make implicit bias worse. They prevent the time to get to know people, and you're stressed, so your brain just kind of retreats into what it knows. So maybe that means like you have to actually deal with HR overwork in the department itself so that the people working there can have more space. And depending on your appetite, you might be able to adopt a bunch of repriming the brain kinds of activities, but those are often best done by individuals and voluntarily.
All right, I think we have time for one more question. If anybody has one more question. Yeah, Representative Field.
Thank you so very much for your message today. I was wondering if you could help me bridge the connection between color blindness and that light is where the pain is. Because right now, I believe that we're living in a political moment where there's a lot of pain, there's a lot of anxiety, where we see Muslim bans, we see an attack on DECA students, we see an attack on transgender not being able to serve. So we're seeing a lot of light being exposed to diversity almost, people who aren't whatever. But there seems to be a lot of pain associated with people that I serve and I represent. It could be an attack on the healthcare system, taking away Medicaid. I mean, there's so much exposure as relates to removing opportunities and barriers for people who are struggling every day, working very hard. And so when you say that the light is where the wound or the pain is, and you talk about color blindness, I believe in those things, but I'm having a hard time understanding that. How do we transcend?
Okay.
You said don't march, but sometimes that's all people
Oh,
know
I
how
don't
to
think
do.
I said don't march. I might
Well-
have said don't march first if you're not ready
Yeah,
for
but
the
at
march.
this point, there has been a lot of rallying to express their voice, because at this point, people are exhausted.
Yeah.
I think that we're all fatigued with the level of hate that I think that's being directed at people of color. And so how do we bridge this color blindness, and the light is where the wound is, when I think that we are fatigued and people are going underground because of the risk that's involved when you elevate yourself?
Yeah, yeah, I totally get that. But what's the color blind, don't,
That some people don't have, they want to look at things as being colorblind.
right,
Policy, like
right,
say, okay, vote right, yeah, there's a lot of public policy,
yes,
it's really based on race and color,
yeah,
and it's to exclude or deny access.
yeah, yeah. So this is what I would say. The idea that the wound is where the light enters, that's the actual quote. The wound is where the light enters. I think Rumi lived thousands of years ago, so I'm just going to try to interpret. I think that the line refers to the idea that when you're wounded, our immediate reaction is to try to close up the wound and stop the pain. And so that could lead you to avoiding race discussions because you feel, I definitely hear it, I feel the fatigue that you're talking about, and I hear it a lot from people. But I think that the idea is there is opportunity in that pain, and there is understanding in that pain, and that if you, rather than trying to avoid dealing with the pain, you took it up and really started to take it apart. Why are we in pain? What is causing this pain? What could we do to change this pain? Those are points of light. That's where light comes from. The light toward actual solutions and toward actual unity. Color blindness it's impossible. It's not anything that we can embrace and expect to make progress on racial equity. So the bridge I guess the bridge might be something like, if we're going to deal with this wound and really heal it, not just cover it up, like not just take an Advil so we don't feel the pain anymore, but actually heal the injury, then we have to be able to see our racial situation clearly. And in order to see it clearly, we have to be able to talk about it, and we have to be able to stop pretending that colorblindness is a worthy goal. It's not a worthy goal. It's not a goal that in 60 years has gotten us to where we need to be. And it is not what's going to heal our wounds. I think people embrace it because they think, oh, I'm in pain, and if I'm colorblind and the people around me are colorblind, I will no longer be in pain. But that's not the case, and I think we have to explain that to people. And as a legislator, you are so uniquely positioned to do that, I think, but you have to educate your constituency about that, because they've got messages from distortions of Dr. King on that say, and from their churches and synagogues and moral spaces that say, don't see color, and no one is telling them, you can see color but still be fair. We could see color but be fair. And that's the job in front of us, is to craft a country a society where we can all be who we actually are and not have rewards and punishments handed out on the basis of that. Yeah, thank you for asking the question.
Well, how do you think? Thank you again. Well, thank you again to Rinku Sen for her amazing words. Rinku's been one of my heroes for I can remember when I was in college, like a freshman in college, I read her book, Stir It Up, and it sort of changed my entire pathway in life, so it's really a treat to spend some time with you today. I love this event, Health Talks, every year because it allows us some time to take a step back, to be inspired by some incredible leaders, and to take some space. We don't have enough space and time in our daily lives, especially Haley, my wife, is here, especially us with kids. We're just running frantically, so we get to push the pause button and be sort of in this mode of reflection and also celebration. So that's what we're moving towards in the program now. We get a chance to celebrate some incredible leaders in our community. And as you hopefully know by now, this event is also our major fundraiser of the year. And so we're lucky to have an incredible base of supporters here in the room, from our foundation partners, our members who are here out in strength, our investing partners, and our donors, individual donors. And as most of you know, I think back in March, we rebranded as an organization. We sort of pivoted as an organization after 20 years of being called the Colorado Coalition for the Medically Underserved. We rebranded, renamed it ourselves the Center for Health Progress, and also sort of took this out front stance as an organization, this health equity stance. Sort of drew a line in the sand and said, we are a health equity organization, this is what it means. We started to be more explicit about and name race as a driving factor of health disparities. And as part of this rebirth, we have been doing some reflection and some thinking about sort of what our foundation looks like as an organization and what the 20 years that came before it looked like. So I'm excited to start celebrating that foundation today. I'm about to introduce two members of our brand new program called the Founders Circle. So we have founders who are donors who've reached a lifetime gift in their life of at least $5,000 by the year 2020. So they've been contributors of our organization for a long time, and the year 2020 means that many of you in the room may be Founders Circle members in the coming years. There's still an opportunity. Our first founder is our actual founder of the organization, Dr. Gary Vander Ark. I'd like to call Gary up here and produce this award. And our second founder is another legendary leader in healthcare, Dr. Bruce Madison. If you can come up, Dr. Madison. So these two doctors, these two men have been made such a huge impact on healthcare. I think many of you have been inspired by them in the years before, and they've cemented their legacy in Colorado, and we're so honored to have them as part of our founders, as part of our organization. They've meant so much to the growth in the beginning, the genesis of our organization, and it's going to be a treat to see where this work continues to go with them, sort of standing on the shoulders of their work moving forward. With some other thoughts on this topic, our board vice chair, Lisa Van Raymond, is going to be coming up right now.
Hey everyone, so good to see the faces in the room that sometimes I don't get to see as much anymore in my new position. It's wonderful to see you. I wish we had an actual mic so that Rinku could just drop it and I could go, hey, give money. I do have some prepared remarks. Those of you that know me, Lisa Van Raymond, I work at the School of Public Affairs at the University of Colorado Denver, and I'm on the board of Center for Health Progress, and usually have no problem getting in front of a big room of people and speaking. I led a webinar this morning. I'm going to go lecture in a class at the School of Public Health this afternoon, and about 6 minutes into Rinku's talk, I started sweating. I have to follow that? Are you sure? So I'm going to do my best and just know that she is why we have the keynote, why people aren't paying me to travel around the country to be your keynote. But I am here for a purpose. So I want to talk a little bit more and bring up a little bit more, raise up what Rinku talked about in terms of impact and what your impact can be, right? We love that she came to visit us, but she's leaving, and we're all staying. We're here. What is it that we're going to do together And what is it that we're going to hold each other accountable for doing together? No one's going to be calling Rinku and saying, here's what Colorado's doing or not doing, right? It's the rest of us in this room that really have to think about what is our individual and collective impact. And that's our chance. I think, as we heard, we certainly are in a different place this year than we were last year as a country, as individuals, and in Colorado as well. I know personally, I'm thinking of the wildfire risk of my home and the fires that are happening in our west. Many of you, I know I personally had parents that faced Irma. You may have people that faced Harvey. There's just a lot of stuff hanging with us in this time. And it can be hard to figure out how to sort of move through all of that and do something, right? It can be paralyzing. It can, everybody talks about there's this flight response and a fight response, but we often forget there's a freeze response, right? That sometimes what we do when we're in a tough situation is just freeze. And so I'm going to implore us to not freeze, even though we know we're in this tough space. So I'm going to kind of set my tasks for you and for us, because I'm on this journey, just standing up here with you all, in sort of three spaces for us today. This is a fundraiser, so one of them you can guess. But there are two others. And the first one really is community engagement, right? We talk about this, it's become a buzzword. Community engagement, we think, voting, right? Sure, we should vote. But really, it is volunteering, it is activism, it is finding that right space for your voice and using that voice. It is amplifying the voices of others who are sitting next to you in a way that does not turn that into your voice, but just amplifies theirs. We could think about what are the one or two things that you really care about. Is it the Children's Health Insurance Plan and that continuation of funding in that space? Is it protecting our incredible dreamers or others who we see being just sort of very intentionally attacked these days? Is it getting a sidewalk in your neighborhood? Something as simple as that. There truly, really, in my lifetime, has not been a better time to get engaged. There has not been more of a reason, there's not been more of an active space to get engaged. And so look for those places in your workplace, in your community, in the schools that your kids go to, etc. I think one of the pieces of that for me, especially in my new role at the School of Public Affairs, and I want to acknowledge, is certainly at our state capitol. So I know we have some legislators in the room. We had some that snuck out. So I'm just going to read the list of those who RSVP'd because I think that's an honoring of those that were here, either individually or in spirit. But those state legislators who are actually here, would you stand up while I kind of run through the list of folks who, so we can honor you? Those that stayed. So, House Speaker Cassandra Duran, Representatives Adrian Benavidez, I'm sorry, that was terrible. You can announce my name terribly some other time. Joanne Janal, Dominique Jackson, Susan Lontine. We have one of Jonathan Singer's staff members, Eliza, I believe Dan Pabone, Senators Larry Crowder, Rhonda Fields, Steve Fenberg, Beth Martinez-Humenik, who I saw, Dominic Moreno. These are folks that are our allies at the state legislature and are really fighting in that space for us and with us as the Center for Health Progress. I also know we had some RSVPs from people representing our federal delegation here. So if you're here representing staff member for a federal legislator, would you also stand? So again, those folks who we know, our hearts and the staff, are going to be with us. We know how the world works. Representative Diana DeGette, Representative Jared Polis, Senator Michael Bennett, and Representative Ed Perlmutter all had people coming to spend time with us today and talk about this important issue. So thank you to those of you for lifting our Colorado voice federally for us. So step one, find your right space for community engagement. Step two, be brave about that. Don't make it what it was last year, because that clearly was not enough. So in those spaces, I implore you to be braver than you were. I'm trying to be braver than I was. In some cases, I'm good at it. In some cases, I'm not. And I have plenty of friends in this room who are terrific at challenging me and pushing me that I lean into and hear from when I'm not pushing and being as brave as I should be. One of the things I always am working on lately is this idea that Rinku brought to us is that it's not enough to have good intentions. I have all kinds of good intentions. I have all kinds of good ideas, but what I do is really what's most important. And so that's a personal journey that I'm on. If that's something that you also struggle with, I ask you to join me on that journey. So I think, really what we heard, really examining our own implicit biases, seeing and calling out the hidden and systemic roots of the forces that are at work. And what we heard was to courageously name them. Don't just see them, think about them, notice them, and walk out the room. Stand up and name them. This takes practice for me, I know, being in a space. Like, how do I raise my hand and say, please don't cut that person off, she has something important to say, let's hear it, right? How do I do that? It takes practice. And I would say look around the room, because these are people in Colorado who care about this issue that might be good practice partners for you in this brave space. I think I'm going to just, talk to my white friends in the room. Us cultivating this ability to be challenged, to be pushed, for someone else to notice our implicit bias and to call us out on it or call us in on it, and for us to lean into that, despite the fact that it's not our intention and that wasn't what I meant. Zippa the lippa, and listen, and really hear what that is, and go home and figure that out for yourself, right? That's an important space that I think we can do work in, so that we can be better in the spaces that we want to be effective in, right? So, number 3, maybe after this amazing and sort of mind-blowing conversation today, is giving money. Perhaps the easiest thing you could do before you walk out today. I don't know. I do want to just again acknowledge there's a lot of places and people who need our financial support today, right? I think, just Harvey and Irma and the fires are very acute spaces that we know today need our money. And there is work happening at Center for Health Progress that needs our long-term dedication and support as well. And so this is that both and. Yes, acutely give to the things that are really hitting you today, and consider a gift to Center for Health Progress. I would say that I was drawn to Center for Health Progress several years ago and started because the staff and the rest of the board were such an amazing group, and it has only continued to grow in my heart in terms of the work that we're doing together. The new staff, the new board, the new name has continued. And I'm kind of scared because I'm on year 6 or 7, and I know at some point they're going to kick me off, and I'm not sure what I'm going to do at that point. I'm going to be one of you just writing a check and supporting the mission, but not maybe it's quite day-to-day involved. So we know that we've come a long way in our state in the past couple of years, and part of that is because of this collective work, right? When we think about this, again, the state work, the work at the state capitol, when we think about the health equity journey that the Center for Health Progress has been on, we know that we want in Colorado a healthcare system that values people and quality of care over money and quantity of care, and we're on a journey to get there, but we need your help, your time, and your treasure, as we call it. So I would just end by saying, I'm making my donation today, one of them, partially because it's a nice thing to do, but also because I know in my heart that the work that this group is doing is really an investment in our future together. So I would say that quickly, we always say this at this event, the purchase of your ticket was helpful to give us this amazing space, Rinku, and the food you ate, but is not necessarily the fundraising part, so we'd like to make sure that you're familiar with that. And then we also try to make it super easy, so if you have your credit card handy, we have several staff people, raise your hand, with easy swipe cards. Don't worry if you didn't bring your checkbook. they're happy to swipe for you, and you'll just get a receipt in the mail. So I'm just going to invite you to take a moment. There's hosts at your tables. They will help you fill out that fundraising form, and maybe look to the person next to you as we're talking about the money part to say, this is what you're going to commit to as an individual, leaving this space. This is what you want to work on. Share that with your neighbor, because we're here to support each other in that transformative work. So take a few moments with that, and then I think Joe will be back up with our Champion Awards in about 5 or so minutes.
All right, everybody, I think we're going to bring it back together. You can wrap up your conversations and find your seat again. All right, thank you. So we've reached the time of our year, our program, really one of the most exciting and fun times that we have at Center for Health Progress, our Community Champion Awards. First, I want to thank everybody so much for being here and for your generous donations to do this work. It's incredible to have such support and to feel like we are part of that collective, as Rinku talked about, that we're not just out here by ourselves. So it's great to see familiar faces, and thank you. So I want to introduce the awards that we give out every year. So we have 4 awards. We have our Physician of the Year, which honors the doctors who are tirelessly committed to caring for Coloradans who face the greatest health inequities in Colorado. We have our Non-Physician Provider of the Year, which honors the dozens of other healthcare providers, from physician assistants to EMTs to community paramedics, that also provide outstanding care to these populations. We have our Community Leader of the Year award, which honors individuals who really are on the front lines driving change in our healthcare system to make it better every day. And we have our Lifetime Achievement Award, which honors someone who's dedicated their life to creating opportunities and reducing barriers to health equity. So the awards we have, they're pretty nice. They come with this little plaque. But we also have a generous donation that we make to a nonprofit of the choice of the awardee. So it's kind of a nice award to honor their work. And without any further ado, let's get into it. So our Physician of the Year this year is a Centura doctor who is leading the transformation of the clinical work across the Centura system. She's a family medicine physician practicing in Evergreen and Idaho Springs. And she's committed to meeting the health needs of those affected by inequities due to race, place, or income. When the Idaho Springs community identified a need for a medical clinic, she worked with them to support their goals and helped make it happen up in Idaho Springs. According to her nominator, she cares for every one of her patients above and beyond what is expected of her so many times that it is now the norm. Working with her inspires others in healthcare to give more to those who need it. Our 2017 Physician of the Year award goes to Dr. Kimberly Bentrott. We're doing pictures with the awardees? Yeah? No? Oh, please.
I would just like to say very few words, but thank you very much for this very surprising honor. I say surprising because I think honors should go to people who do amazing things all by themselves, who can lead and transform communities. There is nothing I'm successful at without the help of a lot of hands. So I was shocked to even get this award at all, because I can't do clinical work without MAs and office staff who reach out to my patients and connect them to the resources that we know are important. And I can't do my own practice without administrators who support us and give us systems and give us supplies that we need to reach out to people. And I can't work without my community integration team who go out to community stakeholders and partners and make those connections and nurture those relationships that allow me to get my patients the care they need in a really complex time when myself or even a health system can't do it all. So thank you very much, and I only accept this award as a representative of people who work really hard every day to care for the lives of others. Thank you.
All right. So our non-physician provider of the year, we had so many incredible nominations, we couldn't pick just one nominee. So we have two incredible winners this year. Our first is a nurse at the Denver Metro Tuberculosis Clinic at Denver Public Health. She coordinates about over 10,000 visits a year with a patient population that has really great needs and limited resources. And she provides this compassionate quality care for those suffering from this really stigmatized disease. In her free time, on top of all this, she also finds time to be the vice president of the Mile High Black Nurses Association, and she also mentors nursing students who come from racially diverse backgrounds. According to her nominator, her passion is evident and her leadership qualities shine. Our 2017 Non-Physician Provider of the Year award goes to Muriel Whitaker.
To say that I'm honored would be an understatement. I would definitely like to thank the women at the Colorado Center for Nursing Excellence for this wonderful nomination. But I have to echo Dr. Vinacourt that I could not have done it without my team at Denver Public Health and the Denver Metro Tuberculosis Clinic, who have taken on the initiative to champion health equity within our doors. So thank you.
All right, so our second non-physician provider of the year award goes to a physician assistant and the clinic director at Doctors Care. She provides compassionate, high-quality patient care and has this exceptional commitment to improving care delivery and really towards integration of medical and oral health care as well as telemedicine. She mentors and trains students, providers to encourage their work with patients who have complex needs and complicated lives, and she even uses her vacation time to travel to Costa Rica to work with Honduran refugees. According to her nominator, Sue is an extraordinary human being who gives not only of her time and talents, but also of her heart, extending healing and friendship to patients. She is also a gift to her staff, and I'm lucky to have the opportunity to learn from her experience and wisdom. That may sound over the top, but so is Sue. Our 2017 Non-Physician Provider of the Year award goes to Sue Covington.
Speaking, so I have a couple of words to say. What a wonderful and unexpected honor. The opportunity to give my time and care at Doctors Care has been a blessing in my life. When I left private practice to work at Doctors Care, I had no idea that I would be given an opportunity to work among the most compassionate healthcare professionals and colleagues around. The patient population has deep need, but also deep gratitude. I am reminded daily that working together we can overcome the greatest of obstacles. Listening to the challenges our patients face can be consuming at times, but the reward of making that supportive connection is worth the effort. Doctor's Care is an example of what true care and collaboration can accomplish, and in this day and age, it's a breath of fresh air. Opening doors to people that have had one too many clothes on them is more than a job, it's a calling. And that is why I say I have found the sweet spot in my career and in my life. Thank you all so very much.
All right, so these next two awards, I'm very honored to be able to give to these two individuals. I consider them mentors of mine and heroes and also friends. So our community leader of the year is CEO of Mountain Family Health Centers in the Roaring Fork Valley. He's driven by the simple principle that access to healthcare is a human right. Imagine that, right? So he's a tireless champion for health equity and access to high-quality patient-centered care. He's overseen the growth of 8 clinics to now serve over 18,000 patients. And he once sent me the list of boards and commissions that he serves on, and it's a little bit ridiculous. So he's so committed to doing this work across the region and in the country. According to the nominator, he is a champion for rural mountain communities, equal care and access, and compassion for everyone. And he's such an impressive leader in general. Our 2017 Community Leader of the Year award goes to Ross Brooks.
Thanks to my brother from another mother, Joe Salmon. I'm particularly and acutely aware of the immigrants that got me here. One would be my Dutch immigrants who moved to Western Michigan in the 1800s, taught me the value of hard work, wooden shoes, and if you ain't Dutch, you ain't much. Second would be our community health center folks that started community health centers in apartheid era South Africa with the Zulu tribes who believed that healthcare is a human right and should be delivered to all people. We immigrated that idea from South Africa and brought it to the United States in Boston, Massachusetts, southern Mississippi, and in our own Denver Health. I see folks from Denver Health here right now, the 3rd community health center in the United States. And I'm particularly grateful for the immigrant families that serve at Mountain Family Health Centers in Western Colorado. Some of those folks immigrated from Wisconsin, Minnesota, and New York to Western Colorado, some from Cuba, some from Mexico, and some from Guatemala. Some of our families are parents of DACA kids today. They are grandparents of DACA kids today. They are brothers and sisters of DACA kids. So I'm grateful for the immigrants that got us and me here today, and I ask that we continue to stand with those immigrant families moving forward. Thank you.
All right, so our last award, our Dr. Gary Vander Ark Lifetime Achievement Award, who is named after our founder, Dr. Gary Vander Ark, who was honored earlier. It really takes a special person with decades of experience and exceptional dedication to be nominated in this category. Yet year after year, we get these incredible nominations, and we're torn between a number of iconic figures in the Colorado healthcare and health equity landscape, all of whom are more than deserving. This year's winner has devoted most of her career to helping Colorado's immigrants and refugees. She recently retired as the CEO of the Asian Pacific Development Center, and grew the programs, adding a primary care clinic and legal aid clinic. Under her leadership, the organization has flourished and offer these incredible integrated medical, behavioral, and social services out in Aurora. She also served on countless boards, task force, councils to build a healthcare system that works for all Coloradans. According to her nominator, her dedication and humble persistence continue to open doors and make a difference in our community. Our 2017 Lifetime Achievement Award goes to Chris Wanafuchi.
I wasn't going to say anything, but I wanted to wait to see if everybody else was going to say something. Because I spent many days and many hours to think about what I was going to say. First of all, thank you for this award. I'm honored and I'm deeply humbled to receive it. And just to make a comment, lifetime means many years. As you can tell, I've had many years of living. But I wanted to share one thing, and I hope you can take this with you. Many years ago, I read somewhere that there were 2 reasons why we are here as mankind. One is to continue our species of mankind. And the most important part, the second reason, is to help each other. So as I sat here and I heard Rinku talk about, all of the racial issues and the racism we're feeling today, as a woman of color, I can say I honestly know where that means. But throughout my life, I found purpose in meaning to really, no matter who you are, to get up and help each other, because that's the only way we can continue our species. So I hope that, I'm sure all of you continue to do that daily, but I would really emphasize now is the time we need it even more now with all the challenges we're facing now. Again, that's it. Thank you. I'm honored and I'm deeply grateful for this award. Thank you.
All right, so that brings us to the end of the program. I just want to say a couple things. We live in the most divisive and challenging times right now. When we were having breakfast this morning with Rinku, one question from the participants around the table was, can you even have hope in these times? And Rinku quickly said, of course, hope is pervasive, it continues. And one of the fundamental beliefs, I think, of this organization that a lot of people really resonate with, everybody on staff wakes up every day, everybody on the board, and really believes in that we have hope that we can make the world a better place, right, every day. I want to recognize those amazing staff members and board members. If you could stand, if you're on staff, or just wave your hand. We've grown a lot. We've grown a lot as an organization, especially in staff over the past year. But one thing that I know at the deepest core, is that all of these individuals come to work every day with this incredible passion to make the world better, and with this hope, right, that sort of springs eternal. And I really believe that we must continue to stand up for what is right, and that the healthcare system has this really unique opportunity to be this fierce leader in this space that we're just sort of stepping into for the first time in a lot of ways. The incredible resources, the incredible ability as anchor institutions in many of our communities to step out and to be explicit about a lot of these issues in new ways. And we have leaders like Rinku. I want to thank Rinku again to help inspire us and to keep giving us that hope as we move forward and be partners in that work. I do want to ask all the board members to stand if they could and just say thank you so much for your service. This is an incredible group of folks who are the best board in the business, I truly believe. So you all should join us if you're interested. And in particular, I want to call out Katie Bain, who's our staff member. She's in the back there saying, "Don't talk about me, please." She helped put this event on. She led this event for the 3rd year now, and it's always incredible to see everybody come together. It wouldn't have happened without Katie and everybody else supporting her to do this work. And then lastly, I want to thank our sponsors one more time, our premier sponsor, Delta Dental Foundation, plus the many other sponsors listed on your program. And most importantly, all of you who came today, thank you so much. We look forward to continuing to step out into this new bold path with you. Sarah's reminded me to tell you to fill out your evaluations as you leave, please. And we look forward to seeing you next year. Thank you.